Hi, this is Dr. Donald Pelto. I want to go over a little bit about some of the causes of pain to the front of the foot. So some of the most common causes are neuroma, metatarsalgia, capsulitis, plantar plate tear, stress fracture, sesamoiditis, and pad atrophy. The reason I put these all in one presentation and not multiple presentations is because they're all kind of interrelated. So let's go and look at them. So first of all, looking at this is a woman's foot in a high heel. You can see a lot of the conditions. For example, metatarsalgia happens at the ball of the foot. You can get an ankle injury. There can be an injury in the back. That's called a pump bump. The bunion, the hammer toe, the Achilles tendon, the neuroma, all these things. One of the culprits is a high heel shoe. Not always, though. So I don't tell all the patients to stop wearing it. Let's go on to look at neuroma. So a neuroma, people say that they feel like they have a sock bunched up in the front of their shoe. A neuroma is a little enlargement of the nerve between usually the third and the fourth toe. That's called a Morton's neuroma. Between the third and the fourth toe, it can develop that. But it also can be found in the fourth, in the second, and the first. They all have different names, but pretty much it's a squeezing of the nerve between here. Now, what can make it worse though is a tight heel cord, because if your heel cord is tight and you're not moving at your ankle, you're going to be putting a lot more pressure to the front of the foot. That's going to cause more of the pain to that area. So that's the nerve. The way we treat this: cortisone injections, orthotics to take the pressure off the area, and then ultimately removing it if we need to. Next, let's look at metatarsalgia and capsulitis. So metatarsalgia is a painful bone. So these are an example of the bones. Underneath the bones, those are the metatarsals. They can be painful. The capsule is the area that goes around the bone. Kind of at the joint area, there's a capsule, and that can become inflamed as well. This can be made worse, once again, by a tight heel cord because it increases the pressure. But basically here, if you look at the picture, the blue is more of a bursitis or a metatarsalgia, and the red is more of a capsulitis. Now this has to be determined that it's not a plantar plate tear. That also can be confused with this as well. How do we treat this? We treat this with a cortisone injection, only a limited number, because sometimes it can cause actually the toes to become hammer toes. And we can also try orthotics to take the pressure off, and sometimes there's a surgery to reduce the length of one of these bones if it's needed. A plantar plate tear is related to the capsulitis and bursitis and metatarsalgia, except the capsule, which is on kind of the side, the plantar plate tear. The plantar plate is actually what holds down the bone. So if you look here, here's the joint, the big toe joint. This capsule right here holds down the area of the joint. This is called the plantar plate ligament right here. That can get torn, and it can cause the toe to kind of deviate. It can go either to the right or to the left. And based on where it goes, you can tell what area is torn. And this can be quite painful for people. It can happen if they have a bunion or if they don't have a bunion. And the way of treating this is there's a procedure that we can actually shorten this bone, go in there and sew that up and put a new piece of tissue down here to kind of fix it, and then kind of bring that bone back together. And I'll show you how to do that in a second. One of the big culprits for a lot of these conditions is a long second metatarsal. So if you look here, the second metatarsal is longer. You see how it's longer than the other ones, and if it's longer, naturally when you're walking, this big toe joint doesn't get a lot of the weight, but the second toe does. Now we always say, well, let's get an MRI. Well, an MRI, they have awfully large sections, like 2 millimeters, and that may not show where the actual tear is. So sometimes an MRI isn't the best way to tell what's going on. Let's look at stress fracture. So stress fracture is an actual break in the metatarsal. This can happen anywhere in the body of it. It can happen also in the head. If it happens in the head, a stress fracture, sometimes it can be called an avascular necrosis, or a breaking of the bone and not having enough blood flow in the area. The treatment for the stress fracture is really to take the pressure off of the area using a specialized boot, or sometimes even a bone stimulator is needed. As well, it can be a sesamoiditis or a sesamoid fracture. A sesamoid, these are the two bones called sesamoids. They run along the course of the long tendon that pulls down the big toe joint. And they can sometimes either be broken, or sometimes they can also be in two parts, which is called a bipartite sesamoid. If you have this, we can try a cortisone injection. If that doesn't work, taking a boot and doing a little cutout in this area to offload the area. That means just taking the pressure off of it in like a walking boot. And then if that doesn't work, we actually just remove the sesamoids. Fat pad atrophy, if someone is missing fat pad on the bottom, there are different types of pads that you can try, or there's surgical procedures to add fat pad to the area. So how do we treat this? We initially get an exam. An x-ray is helpful for a lot of these conditions to see if there's a difference between a bone break or just having a long bone that's causing problem, or having a stress fracture. We examine, we push on the area. For most of these conditions, cold therapy or ice or biofreeze can help. Anti-inflammatories like naproxen can help. New shoes, shoes are a big culprit. If you don't have the right type of shoe, a lot of these foot conditions can be made better with this, because high heel shoes or shoes that are too narrow don't help this. Pads that can offload the area. This can be helpful for like the hammer toes right here to take the pressure off. This is a little pad that offers padding in the ball of the foot, as well as some gel pads. Those can be helpful. Stretching can help, especially in the Achilles, because we want to reduce the pressure to the front of the foot. So always stretching is important, and I tend to use trigger point tools, which are some tools that you can use in the back of the calf to loosen the pull and help the ankle joint move better, so you're not putting as much pressure to the front of the foot. Orthotics can be helpful as well. For example, in a neuroma or metatarsalgia or capsulitis, it can reduce the pressure to the front of the foot, help stabilize the heel. That's the main key of the orthotic, and they can offload the area of pain. They help with any pronation, so over flattening or over extending the pull. And the main key is you have to have a deep heel cup to reduce the abnormal motion. Injections can help. You have to be careful doing too many injections, because it can cause weakening of the ligaments and cause hammer toes and other problems. Physical therapy sometimes can help with taping and different types of tissues or Graston technique. And then some of these other things that can help. This is one of those walking boots. That can help with a majority of these conditions if they're very painful. Used temporarily just to reduce down the inflammation. Also, an air heel can help. It has actually an air pad right here that can take the pressure off the front of the foot. This is an example of the CPR procedure. This is for a complete plantar plate repair. That's that plantar plate thing that I was talking about, how it has a little tear right here, and we actually go in there and sew it to the bottom of this bone right here, and that brings everything back together. You can watch that video if you want on this complete presentation that you can find at drpelto.com. Under patient presentations under forefoot pain, it should be there. As well, neuromas, the treatment for that is actually removing it. You remove a portion of the neuroma right there. It's one of actually the only nerves in the body that's removed. Sesamoid, here's an example of sesamoid removal. We can remove that. And if you're interested in surgery, certainly you should see your podiatrist. I do have a presentation on surgery preparation, what you need to know. Hope this helped. If you found this helpful and you'd like more information, go to drpelto.com, and there's a place you can put your email, and I'll send you a link to all my patient presentations, all the videos, and all these resources for you.